Welcome to Norfolk Perspective City Slice. I'm Bob Batcher, and we are blessed in this city to have CHKD right in our own yard, not even the backyard. It's right there smack in the middle of our yard. And Dr. Joel Brenner, who is the medical director for CHKD Sports Medicine Program. How you doing?
Good, thank you.
And Mitch Callis, community liaison with the same program. So are we going to be talking about kids, sports, or all of it?
All of it.
Okay. When I think of kids in sports, I think Little League and go out there and start off maybe with some touch football. But I also think of the mom and dad saying, let Johnny get out there and knock some head, and the mom saying, yeah, but he might get hurt. Is that a topic you're used to hearing?
Yeah, we hear that quite frequently, whether it's on the field or in our office too. And I think the important thing is for each athlete and each family to have a discussion of what's appropriate for that athlete, what they want to do, and what's fun. And that's the key when we're talking about sports with kids, is the bottom line is it has to be fun.
Now, when we talk fun, I also hear parents talk about my son or daughter is not getting off the sofa. They come home from school, they're not being active, they get involved in their Facebook and their games and whatever, and they're not getting out in the yard. Is that a concern you hear about too?
Oh, definitely. I mean, we've have different extremes. We've got a lot of kids who are spending extra time on the screen, whether it's the computer or on their smartphone or on their iPad. And then we've got kids who are doing too much, who are playing sports year-round and specializing. So we want to take those kids who are less active, find activities that they enjoy, and it doesn't have to be football or baseball or basketball, finding other activities just to get them physically active, such as dancing, or just other unstructured activities.
Well, this kid over in this seat, at the age of 60, decided I was going to go get fit. And it wasn't a matter of just going out there and start running. But I walked around the block, I got on my bike, and I kind of met my limits. But there were these words in the back of my head from when I was a kid of no pain, no gain. Mitch, have you heard those words before?
Yeah, that's kind of our generation of talk.
So are we going to take the kids from the sofa and say, go out there and do it?
No, it should be a gradual progression, and particularly with kids, it should be something that exposes them to a lot of different activities. Later on down the road, they can specialize in something, but young, you should build a foundation of good activities that help develop them, build their strength, their conditioning, their flexibility, and things that help keep them from getting hurt.
Now, Dr. Brenner, you're going to be bringing to our community a conference June 19th.
Correct.
We're going to talk about some of this stuff among professionals, right?
Correct. Yeah, this is our 8th annual sports medicine conference at CHKD. It's an all-day conference, and some of the special topics we have this year are Dr. Couture's sports medicine specialist out in California, who also takes care of USA Volleyball. We'll be talking about taking care of performing artists and also talking about respiratory problems. We'll have a discussion about CrossFit for young athletes, as that's becoming more and more common.
And it's a big discussion among adults, too.
Exactly, exactly. We'll have discussions, a couple of discussions about concussions and taking care of youth athletes with concussions, and then also just a provocative discussion about youth sports culture and some of the topics that we're talking about here.
There's the whole talk now in the news of NFL and the concussions, the impact in retired NFL players, to the point there's some kind of pushback to say, well, maybe football should be banned in schools completely. Are we talking about extremes here?
We really are, and I think, we're trying to come together, I think, as a society, as sports medicine organizations, as physicians, as parents, of what's realistic, what's safe. We see concussions in all sports, not just football. We see it in wrestling and cheerleading and dance and lacrosse, all over. And so we have to figure out, ways to prevent concussions and educate people. That's actually, tomorrow, the president is holding a summit at the White House on youth sports concussion. So I'll be attending that. And hopefully something good will come out of that. We'll actually be promoting more research and more education on concussions in sports.
Now, Mitch, I go back to my background where my mom said, you wear glasses, you got a shirt, you better not participate in that. So I didn't really have a lot of experience in school with sports. So then when my daughters were coming up and they were getting opportunities to dance, and I remember that night, I think she was about 12, came home and said, Mrs. Cooper wants to put me up on toe. Number one, I had to ask, what do you mean by going up on toe for ballet? So where does a parent turn to get advice?
Well, that's a really good point that you make, because there are a lot of things when you're dealing with, particularly with kids, with growing, developing bodies, that you don't treat them the same way as adults. They're not miniature adults, so they have special needs, and that's one of the things that we specialize in. Parents want to know, when does that kid go up on toe? When is it safe for them to throw a curveball? Because when you're 12 years old, a curveball is a devastating pitch to a batter. So parents want them to be able to throw that, but you have to wait until you're skeletally mature enough to be able to do those activities.
Wow. I thought it was just a matter of the skill.
No.
Now, okay, but it also seems like things are accelerating now. I mean, with all the attention to the Olympics and whatever, gymnastics. I mean, they're small, they're short, they're young. So let's get them up on the bar when they're 5 or 6, right?
Right. Yeah, they're now in that sport of gymnastics. Now, I have a lot of experience with that because I have 2 daughters, and both of them were pretty accomplished gymnasts. And gymnastics spends a lot of time in progressions, gradually moving a kid from a very primary skill up to advanced skills. And it's probably one of the safest sports out there for the activities that they're doing.
Really? Because it takes into account the size and the age.
Right. We see very few injuries that are related to flexibility or that are related to strength, because they do so much of that in their preparation of the sport.
Okay, so let's talk baseball. You mentioned the curveball. Let's go out and throw the ball, John. Be sensitive to skill level or age?
Oh, absolutely. The skill level and the age, the amount of pitching, as Dr. Brenner talked about, trying to specialize in one sport. We run into problems with kids that are playing on their neighborhood team, then they're playing on a Sunday select team, and they're playing on an AAU travel team. And because they're trying to get them this type of exposure in the sport, making them better. But you've got to find the happy medium in there where you keep the kid enjoying the activity, staying with the activity. There are a lot of worse things that can happen to a kid as they get older that don't have anything to do with sports. You want to keep them out there. And the thing that they're looking for is making it fun.
Sure. Now, equipment. Some people will say, okay, I've gotten off I don't have to worry about no pain, no gain anymore. But the equipment will make it safer.
It depends on the sport.
I like that, doctor.
Yeah.
I heard that.
It depends on the sport. One thing that's important from an equipment standpoint, and it really with the sport, if we just take football, for instance, there's safety standards that have to be met. So making sure that the football helmet fits that particular individual, make sure it's either a new helmet or properly reconditioned. Same with other sports. So it's sport specific, and it doesn't have to be the most expensive equipment. There hasn't been one football helmet, for instance, that has been shown to be better than all the other helmets from preventing injuries. The most important thing is that it fits properly in its condition.
And used.
And used.
Because you had the best equipment, but it was on the bench.
And also that the kid, in those sports, sometimes when you put a helmet on a kid, then they think they can no longer get hurt. You get in that helmet, you're behind that face mask, and sometimes the techniques that are used for tackling or for blocking are not the proper techniques. And there's been a lot of change with that in the last few years.
What are some of the what are some of the more popular injuries you see that could be prevented?
I think the number one, just as a group of injuries that we see, are overuse injuries, and they're completely preventable because they're from just overusing.
So here we go from being concerned that they're spending too much time on the sofa to that extreme of overuse. Of
playing 7 days a week, of playing on 3 teams at a time, of playing year-round.
But he enjoys playing it.
Well, that's great. And some of it depends on what the motivation is. There's some new research that has come out. There's some good research that shows if the goal of that young athlete is to make it to college, then actually if you wait to specialize until you're in high school, that you actually have a better chance of playing in college because you don't get burned out mentally and you don't get injured physically too. So we want them to have fun, but you know, everyone needs, your body needs a break. It actually makes you a better athlete if you give your body a day off so your muscles can rebuild from just the normal wear and tear.
And again, what I like about this is based on your observations and the observations of the people that are coming to the conference, rather than, well, when I was a boy, we did this.
Right. It's not only our observation, but it's actually the scientific literature that's out there,
Right.
of just our sports medicine colleagues throughout the country too. So we've got, you know, a lot of experience with that, and that's what we're going to hopefully share on June 19th at CHKD.
Now, who's eligible to come to that conference?
It's open to the public.
Okay.
The material is really geared more for...
I was going to say, who would enjoy being at the conference?
It's geared for healthcare professionals who are interested in taking care of young athletes. But like I said, coaches, school nurses could. We also, at CHKD, we do a lot of other community outreach. This summer, we actually have a summer coaches conference later in July, and that's open to all coaches throughout the Hampton Roads area. And then we put on monthly conferences for other healthcare providers and parents, and we're open to give any talks to any organization's parents. They can just call us at 668-PLAY, and we're happy to set something up.
That's super, because I know as a parent, you know, you really do put your kids' interest in the hands of a coach or the third party. So probably the second most influential person is that coach or counselor that the student has. So thanks for everything that you guys have done to kind of bring this awareness to us, but also provide an opportunity for gaining more knowledge. Thanks for CHKD. What more can we say about that wonderful institution?
My pleasure. We love what we're doing.
Okay. Thanks a lot. And I'm going to get off the
Thank you
chair
for
now.
having us.
Okay.
Okay, cool. Thank you.
Thanks.
We're going to get off the sofa.
There we go. Super.